going to talk about disc bulge versus disc herniation. So first off, what is a disc bulge? The easiest way I think about a disc bulge is you're taking that spongy disc material and it's starting to basically bulge out in a uniform manner. A disc bulge is typically not as severe as a disc herniation. It's a starting point, if you will. If you think about it, you see a car driving down the road and the tires are really flat and it's starting to almost bulge all the way around. That's essentially what a disc bulge is. So there would be pressure between the two vertebrae. The disc material starts to bulge out, and a disc bulge may or may not cause pain. In some cases, a patient may walk around with a disc bulge, zero pain. In other cases, if it's bulging out and encroaching upon the little nerve root, that's when a patient would start to feel pain. So that's a disc bulge, generally speaking. Now, disc herniation is if you think about a jelly donut and we start putting pressure on the jelly donut and that material starts to almost ooze or squeeze, that's when we're getting to the point of herniation. So more severe pressure, okay? First, disc protrusion, okay? So disc protrusion is where a specific part of the disc actually starts to protrude. So again, if I put pressure here, you'll see that red material start to protrude out and it gets into the canal where the nerve is, okay? So that's a protrusion, a specific piece of the disc is starting to protrude. And typically what's happening is that protrusion, what's happening is the wall of the disc is starting to weaken, okay? So it's starting to weaken and protruding, and again, if that starts sitting on the nerve, that's when we need to seek treatment. A disc extrusion is when we take the protrusion to basically the next level. There's enough pressure where the wall of the disc has weakened to the point where the material from inside the disc is extruding out. So again, jelly donut, the material is starting to like squish out, if you will. Okay, those are tougher cases. We treat a ton of those in the office though. Just typically take a little bit longer to get better. Sequestration or sequestered disc, that is actually where the extrusion, so the material from the disc, sequestered or separated from the disc in and of itself. And so that would be a pretty severe case. Maybe it was weightlifting injuries or something really abrupt where there was a lot of pressure all at once and the material literally broke through the outer wall and now it's sequestered hanging out there. So that's a disc, a sequestered disc.